Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Philadelphia, Pennsylvania, and in Narberth, Pennsylvania on the main line. Today I wanted to talk to all of you who might be having some type of sacroiliac joint pain or sacroiliac joint dysfunction. And first I want to kind of tell you what sacroiliac joint dysfunction is and what part of the anatomy it kind of entails. So again, we're going to look at my model of the pelvis, and the sacroiliac joint is actually the joint that's in the back of the pelvis. The pelvis is made up of three bones, two iliac bones, okay, as well as the sacral bone, which is this cobra head type bone in the back. And when the ilium connects to this sacral bone, you have the sacroiliac joint, which is this gap in between that connects those two bones together. And you have a left sacroiliac joint and you have a right sacroiliac joint. And what can happen is that if there is any type of misalignment or excessive compression or not enough stability in this joint, you can end up having all sorts of symptoms that can range from, pain in the buttock to pain down the leg to numbness, tingling. You can have pain in the groin or in the front of the hip. You can also have pain in the pubic symphysis, which is the joint in the front of the pelvis. Usually, sitting for prolonged periods of time or walking, going up and down stairs, turning in bed will typically, provoke those symptoms. But sometimes just, you can have constant dull, achy type pain also around the low back, the pelvis, or down the leg. Any type of pain in this area can kind of give, issues, typically it's above the knee, but sometimes all the way down into the calf and to the foot, as well as into the front of the hip and to the side of the hip and the gluteals. Now, why does this develop? Now, sometimes genetics can play a role into it. For instance, if these joints, if you think of this sacral bone as kind of like a keystone head on an arch, if the keystone head the keystone is more vertical, meaning like this, you're not going to have as much support versus if you have a keystone that's like this, where it can wedge in and sit nicely. So if we look at the pelvis, the sacrum is kind of like a keystone. And if these joints are more flat, which is typically is in women, then you will have typically more of a tendency to develop sacroiliac joint dysfunction. Now, other things can also cause sacroiliac joint dysfunction. Any type of postural abnormality. So if you've developed a certain type of posture for a long period of time, that can actually change the alignment of the pelvis. And say if you go out and do any type of repetitive activity that you either do too much of, or you start doing an activity that you're not used to doing, that can set off a sacroiliac joint dysfunction or a pain. The other thing is if you have any type of traumatic injury, so whether it's from an athletic injury, whether it's from misstepping, I hear that all the time, is that, someone was running or someone was walking and their foot got caught in like a pothole, or sometimes if their foot gets caught, say in a root or a branch, and they end up actually pulling the leg down because they couldn't clear their foot. So sometimes that can cause sacroiliac joint dysfunction. And then the other thing that's around when it's typically common to develop this is actually during pregnancy and even postpartum, because this joint is actually connected with a lot of, so basically the bones are connected through tissue called ligaments. And these are the ligaments that you see right over here, all this gray area. And typically during pregnancy, because of the hormones that are released, these ligaments will become more loose in preparation for delivering and carrying the baby. And if this remains loose, or it causes an alignment issue because it's loose and it's not creating a good solid compression and stability in this area, then that can create dysfunction and pain that can last even after the baby is born. So this is how kind of sacroiliac joint issues can start. Now, the other thing you have to also understand is any type of an imbalance around the musculature around the joints. Okay, there's a lot of muscles that actually attach from the low back onto the iliac bone, from the low back onto the sacral bone, also on the side. This is actually the hip joint, right in through here. And if you imagine like a rod coming down, that's the hip bone. But there's a lot of muscles that connect on the side as well as in the front. The abdominals actually attach down through the front and onto the pubic bone as well as onto the iliac bone. And then also on the inside, which these muscles that you see in red is your pelvic floor. And actually on the bottom, you can also see the pelvic floor muscles that attach from the pubic bone to the tailbone. I'm not going to get into the pelvic floor because I have tons of other videos that you can watch on pelvic floor and what it is and how many muscles it's comprised of. But basically any of the muscles on the outside as well as in the inside can basically become tight or weak or have a combination of the two. And that can create almost like a tug of war from the outside and the inside of your body, from right to left to front to back to up and down. And that's going to change the alignment of these bones in connection with the sacral bone. And when that happens, and then you combine it again with pregnancy, poor posture, or repetitive activities, that can create pain and issues in the back. So when certain muscles can, when they become too tight or spasmed, they can also be a source of pain, because now that spasmed muscle actually, if you think of a fist that closes really, really tight and then you open your fist, you can see that, your palm turns white and then you open up your hand and, blood kind of rushes to your hand. Well, that's the idea, is when you have a muscle spasm, you basically have almost like a tight fist type thing within a muscle group, and that means that spasm muscle isn't getting good blood flow, and when it's not getting good blood flow, it's not a healthy muscle. And because nerves can kind of run through this area, that muscle can become painful and it can develop something called trigger points. And trigger points are basically spasmed muscles that can create pain in the area, or referred pain meaning that it can actually give you pain in an area where the muscle spasm isn't. So that in combination with an alignment issue can create other pain that can mimic sacroiliac joint dysfunction or sacroiliac joint pain. So what do we want to do? What do we do about this? So here at Rebalance, our biggest thing is the word balance. As part of Rebalance, is we want to balance out all the tightness with the weakness that we see around the entire pelvis, the hip, the low back, as well as the abdominals and the pelvic floor. We have to balance all of that out, because once it is balanced, then the bones have a better ability to stay balanced and aligned, and then we can address the weakness that potentially has also developed over time. So I kind of, when my clients come in, I kind of explain to them, when you have an orchestra, that orchestra, can play beautiful music and, play a beautiful masterpiece if the components of the different instruments are brought in at certain times, and that's the job of the conductor. However, you can have those same people and they're all playing instruments at the same time, and it just sounds like a chaotic mess, and it doesn't sound like a masterpiece. So it's the same idea behind all the muscles that work when you are sitting and walking and lifting and playing sports. Different muscle groups will come in at different times to support the sacroiliac joint. And if they are all coming in at the same time, then you're not going to get good movement in this pelvis, okay? You're going to get bombardment of a lot of muscles if they're all firing too much or too quickly. However, if you bring in first the correct musculature that first stabilizes this, and then the other muscles are recruited, that then helps support and move this in a very systematic way, then you're going to have good music, or a good, a masterpiece of a movement that is similar to a masterpiece of hearing a sound from an orchestra. So I hope that kind of made sense. So that's how I kind of view the body, is you have to, all your instruments have to be tuned so they're playing the right sound. So it's the same idea. All the muscles have to be balanced so that they know what to do. And then you have to train them just like a conductor would do to bring in the right pieces, which is what we do here at Rebalance, is we start to then retrain the correct sequence of how these muscles should fire. And that should produce beautiful movement pain-free movement, and help you feel healthy. So I hope that was super helpful to many of you who might be suffering from any type of pain or dysfunction in the sacroiliac joint. And I'll talk to you soon. Thanks.